Hi guys, so it's me again, and if you don't realise, I have black hair in this video. But anyway, today I'm going to be doing a video, well, a Q&A mental health video, so I hope you enjoy it. So first question is, were you happy when you left hospital? Well, no one is going to be happy to be in hospital in the first place, but mentally I was feeling down when I left. I was struggling so much, but I was happy, really happy at the same time to get out, because obviously I spent like a year in there, and just to get out was amazing. Number 2, how did your family react to your self-harm? Well, to like start off with, it was like hard for them to see in that, because they hadn't like been through it with any of the others, like they hadn't been through it before, but they've like learnt to understand, and my mum kind of understands now, because obviously I've been doing it for years. But there is some family members that just say silly things, and they're not very understanding, but if you don't like it, it's part of me, so yeah. Number 3, how does your mental health affect you from doing day-to-day exercise? Well, actually, exercise is really good for your mental health. So if I do go out on a walk, it always makes me feel good, but finding the motivation and courage to actually go out on a walk is what the hard thing is. Number 4, how do you feel about, number 4. Get a bit carried away here. Number 4, how do you feel about your mental health? Well, it's not something I want to have, but it's part of me and who I am today. My diagnosis didn't get picked up till a couple of years ago, so yeah, but I've been struggling since I was like 13. Number 5, how does your mental health affect your daily life? Well, it's like finding the motivation to be able to do things, and just getting out of bed is sometimes hard for me. Sometimes I find myself like staying in bed all day. Sometimes I'm not. Sometimes I'm up dead early and out and about. But just finding the motivation to be able to do it. Some days are better than others, so. Number 6, do you think borderline EAPD patients get treated differently / wrongly because of the stigma? This is such a hard question. I don't think they quite get it, how 1 minute you can be like have a really high mood, and then the next minute you could be like really low. So yeah, I don't really know what to say for that one. Number 7, how do you help people with mental health issues? Well, like, if somebody was feeling down and that, I'd be like there for them, and I would make sure they were okay, but I'm not really sure. Number 8, how does your mental health affect you around other people? Well, like, I'm constantly playing with my hair and thinking like it's not sitting right, and I constantly think my clothes are like not sitting right, like on right, and I just look a mess and that, so yeah. Number 9, do you think your life would be different if you hadn't been through everything you have? Yeah, about a couple of years ago, I was staying somewhere else, and I got offered my own, this is my own flat as well, but it's in supported accommodation, but I actually got offered my own flat, and if things worked out, I would have been in that flat, but if things worked out then, I wouldn't be where I am just now, so like I'm kind of happy not there at the same time. And obviously I lost my dad last year, so that's been hard. Number 10, do you feel the mental health system have failed you? Yes and no. Like, they failed to like find out what's wrong for like loads of years. Like, I was first referred to CAMHS when I was about 13, and yeah, I had like lots of chats and that with them, back and forward visits, but just nothing was picked up or wasn't really good. 11. Do you think hospital helped you in any way? I wouldn't say it helped me. Like, Murrayroy was such an amazing, like, no, it's not an amazing place, but it's a better hospital than Carshue that I spent 5 months in. And the staff, the nurses were just amazing there. But no, I wouldn't say it helped me, but it helped me to find out my diagnosis, which is EPD. So I'm slowly learning to live with it. It's such a struggle, but just have to learn to get through it. 12. Was hospital for the best or did you hate it? Well, no one's gonna like being in hospital, especially being detained and that. Like, can't do anything. Not much privacy in a hospital either, so it's quite daunting. So no, I hated it. But it was for the best of me at that time, to keep me safe, and that it was just the best place to be. 13. What keeps you going and how do you move on from things that have happened in the past? Well, always think positively and just focus on the future, like forget all the bad things and the negative things and just think positively and on the future. 14. When did you realise you were at the point of depression and needed help? Well, 2018 was when I was admitted to hospital, and I went the whole year. I was continuously like attempting to end my life, and I was continuously hurting myself and just feeling down, and I just was doing so bad, and I just got to the point where I attempted again, and because of everything, I got admitted. I got admitted into hospital. So I got detained in there, so it wasn't my choice, but it was for the best, really. 15. Right, sorry, I got a bit interrupted there because someone was at my door. But anyway, I'm on number 15. So 15 is what happened that you got admitted to Murray Royal. Well, I got transferred to Murray Royal from Carshue. It's just a transfer. But why I got admitted to Carshue was just numerous attempts and being constantly down all the time and constantly hurting myself, and just all these different things added up, and nobody could keep me safe anymore, so the best thing was hospital for me at the point. And the last question is, did you ever think you could be happy again? Well, don't get me wrong, I get down days still, and I get down days still, but I am doing a lot better and I'm a lot happier. Like sometimes I feel down and that, and I just think, can't be happy. But I know I can, but it's just hard to know it. But anyway, thanks for listening. If you've watched all this, thanks for listening. And these are just all questions that people have asked me from me putting it on Snapchat. And people have asked me these questions. So thanks to people that have went out their time to ask me a question, and there's all your questions answered. So thank you. Bye.